Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe drug Clindamycin. Overview and indications. Clindamycin is a lincosamide antimicrobial agent that is a semi-synthetic derivative of lincomycin. Clindamycin is an effective antimicrobial agent for use in treating infection caused by susceptible aerobic and anaerobic gram-positive bacteria. The drug is also used topically alone or in combination with benzoyl peroxide and orally for acne vulgaris and orally for toxoplasmosis. Dosage: oral dose adult 150 to 450 mg every 6 to 8 hours. Maximum dose 1.8 gram per day. Pediatric dose 10 to 30 mg per kg per day in 2 to 4 divided doses. Parenteral dosing: adult 1.2 to 2.4 gram intravenous or intramuscular in 3 to 4 divided doses. Maximum dose will be 4.8 gram per day. Pediatric doses: neonates term 20 to 40 mg per kg per day every 6 hours, intravenous or intramuscular. Preterm babies 15 mg per kg per day every 8 hours, intravenous or intramuscular. Children over 1 month and elder 15 to 40 mg per kg per day in 3 or 4 divided doses. Topical: apply 2 times a day on affected area. Strength available in capsule 150 mg and 300 mg. An injection formulation: intravenous or intramuscular 150 ml strength 2 ml and 150 ml strength 4 ml. Topical lotion 1% 30 ml bottle. Pregnancy category B may be acceptable. Either animal studies show no risk but human studies not available, or animal studies show minor risk and human studies done and shown no risk. Adverse effects. Adverse effects are diarrhea, nausea, dry skin, pruritus, peeling topically, vaginal monolysis, vaginal products, pseudomembranous colitis, rare, can be severe, jaundice, abnormal LFTs, rare. Thank you for watching Daily Drug Info.